How's it going, everybody? I'm Jeff Slakey here at the Mason Foundation office, and I am talking with four great representatives from Mason Health to talk about an upcoming award they're going to get in October for some really good work they've been doing, not only internally, but within our community. From Mason Health, I have Eric Mall, I have Nicole Edens, Pam Schotterhoff, and Melissa Strong. How y'all doing?
Great.
Good.
Good. It's exciting to talk with you about this. Coming up in October, as I mentioned, you are going to be receiving the Ranier Recognition Award through a lot of hard work at the PENW Symposium, the Performance of Northwest Excellence. Eric, let's talk and start with you because these accolades do not come overnight. They are a long process where you have to do some real deep critical thinking into your organization. But even before that, you have to decide, is this the path that we want to take the hospital? So let's start with that.
Well, and so it's stepping back from PENW, which is really, it's a multi-state organization that's, you can think of it as a chapter of Baldrige. And so it's really following the Baldrige framework. And Baldrige was created in the late 80s by at the federal level by NIST as a way to kind of encourage competitiveness within our commerce, and so they took this framework and started to apply it across industries as a way to achieve excellence. And so it's been a great framework for us to just reflect and evaluate where do we have opportunities for improvement, and prioritize those opportunities for improvement, and then just continuously get better.
I know you've been working over the years to really build a super strong team. Some of them are here with you right now. So when you brought this to the group and said, this is the year we're going to look through all of these metrics, and I want this hospital, this organization, this culture here to really work hard, and now you're seeing the results of that.
Yeah, and it's actually built on a long culture of just of improvement and continuous improvement. And so it's really taking a culture that already exists and using the framework really to energize and be inclusive and bring people in. And so it allowed department heads, leaders, and staff all to contribute. And again, by having that focus and that framework, it's really allowed a lot of people to come together and work on this. And it's over a long period of time. And so it's really just in that spirit of just getting better. It's one of those things where it's a process and it's not an outcome. It's nice to get awards along the way, but it's like anything in life. It's all about journey, and it's all about seeking that continuous betterment.
And these go over all the different parts of the hospital and within the different systems there. Nicole, tell me a little bit about just the ongoing evaluation that led up to receiving the award, but this is not the end of it. You continue to make progress and you continue to grow.
Sure, Jeff. Yeah, part of the Baldrige process that continually pushes on you to evaluate yourself. I think that's what I love about it the most, is it creates this accountability on an organization to, when you make decisions or make changes, to say why and how do you know it worked and measure it. And I think that accountability that we're creating with our organization is going to reflect on a higher level of healthcare for our community. And so it's a great kind of iterative process. And even as we're receiving the award, we're taking the feedback from last year and already working on next year's changes and continually striving for excellence. And I think the entire process reminds me, I believe it was Vince Lombardi made the quote, striving for perfection. And so just kind of keep upping your game. And that's, to me, what I think of when I think of Baldrige.
Pam, Melissa, let's talk a little bit about your unique departments within the hospital structure and what you learned through this and what you're taking and moving forward with it. Pam, let's start with you.
Sure. I'm Director of Quality, so I work with all the different departments throughout the district.
And put that microphone a little closer there.
Happy to. I work with the quality department, and so I have the opportunity to work with all of the departments throughout the district. And my team goes out and helps. We use the lean methodology of improvement, and so my team are at the elbow helping people. So we often have opportunities to see bright spots, to see excellence in action, and sometimes it comes from the places you'd least expect it. Housekeeping or the kitchen, or it's not just the doctors and nurses that are doing excellent things. You'll see levels of excellence and improvement being embraced at all levels throughout the organization. So my journey with Baldrige as helping to prepare our application was really taking the criteria, really finding those nuggets in our organization, and being the conduit to tell their story. And so being able to embrace the unsung heroes in healthcare and let their story be elevated.
For sure, yeah. Mel, what about you?
I think for me, the biggest takeaway from this journey has been like the integration. So making sure that we treat processes in a systematic manner, so we can make sure that every single time, you know, a patient comes into the clinic or in the hospital, we're treating the patients the same way kind of through the system. And that way we can find out where there's errors also and fix those errors.
Eric, when patients are looking and they're doing searches out there and that Mason Health comes up and the Ranier Excellence Award is there, what do you think that will do to help better the way that Mason Health is perceived, not only in Mason County, but across the state?
Yeah, I think, you know, across the state, it's just a way to further put Mason Health on the map. And I think, you know, we have a good reputation within the rural sector across the state. Mason Health is an organization that is highly respected. It's perceived as very collaborative. We're always willing to help another rural community, another rural hospital. And so I think we have a very good reputation. And so I think something like this, it's just a further, you know, kind of validation, if anything else, that, hey, this is an organization you can trust. This is an organization that really invites external organizations in to evaluate. And I think there's a high degree of trust and acceptance for feedback by being willing to do that. And so I think that's really what the signal that sends, you know, both, you know, to our community and then more broadly.
How was it working with PENW and the collaborative process to get to where you're at?
Well, so PNW is an excellent chapter of Baldrige. They do a great job of really deeply understanding this complex framework and being able to make it something that we can get our you know, minds around, and help us really segment and have an approach to how do we then adopt and integrate, as Mel said, integrate more deeply into the organization. So they're really, I think of them as an excellent guide, a deep resource, you know, and so just a fantastic partner on this journey.
This is quite the 55th birthday present.
Mm-hmm.
Isn't that something?
Yeah.
To be in the community this long and then be receiving this great award and an accolade to show the hard work that you have done and continue to do here.
Mm-hmm.
It's very, very cool. Well, in October, Eric will be in Bothell presenting or accepting this Ranier Award that they have received, and we're going to have an opportunity to see it and talk more with them after they get the award. It's a very exciting time around Mason Health. You'll be able to read all about it in the upcoming scope in October, and there's more information out there as well, as we've been talking with Eric Mall, Nicole Edens, Pam Schlotterhoff, and Melissa Strong about this great accolade. Congratulations, y'all. You really work hard, and you well deserved.
Thank you, Jeff.
Thank you.
Thank you.
Good job. That was excellent. Thank you. I'm so excited.
Painless, right?
Oh yeah.
See,
He was kind.
Jeff is really good
Jeff's
at
awesome.
relaxing.
You make it
and
easy.
Always.
Yeah.
Yeah.
Now
So
the tough
thank you all
questions.
for
Sure.
taking time out of your day.
Yeah,
That's
right.
really-
Now that you're not mic'd, yeah.
What's the
How's it going, everybody? Jeff Slakey here. Now I'm happy to bring into the conversation Theron Post, and he has been right there along with Mason Health this whole process as they've been working and moving towards this great recognition in October, getting the Ranier Leadership Recognition level. Theron, nice to talk with you, and explain to me a little bit about how you and Mason Health coordinated through this process and talked with them about how they can reach their goals here.
Oh, well, thanks for having me, Jeff. Yes, we've been partnering with Mason Health for several years now and kind of helping them along their path of improvement. The role of Performance Excellence Northwest, which is a 501c3 nonprofit, is to really just provide educational services to help them understand our framework. And then Mason takes that framework and then goes inside of their organization and starts to ask a lot of questions and figure out how their processes work. And that leads them to a document that they submit called an application. And that application is what my organization will take, and with a team of volunteers from a lot of different sectors. I think on their team we had healthcare people, we had manufacturing folks, we had government people. We all take a really different look at organizations and how they work together. And we compile that information and provide them with a feedback report to verify the strengths that they have, and also to give them some opportunities for improvement that then they can strategically go back inside their organization and say, which of these are the most important to us?
I don't want to call them weaknesses, but opportunities to grow, let's say. And when you are first meeting with these organizations and explaining to them the process, I'm sure part of it is we may uncover some things that either you weren't aware of in your organization, or some ways that we think you can improve dramatically. Where would you say Mason Health was within kind of their flow of this process?
Yeah, so Mason Health, being at this for probably 5 or 6 years now at kind of various levels, they've reached the second highest level in our performance evaluation process, the Ranier Award, which you mentioned earlier. And so organizations that are typically at that level have a lot of good processes in place and a lot of things that they're doing that are really helping them move forward. The secret sauce in the framework and kind of what we do is helping them kind of understand and lead them through conversations that identify these opportunities of learning usually. And it's usually not that they're not doing things, it's usually trying to figure out how to do what they do more effectively. And so they can then begin to say, well, what if we tried it this way? What if we did the same process and made these slight adjustments to it? Would that impact the outcome? And then they would try that internally and then see if that was helping them get closer to their goals. And then if it was, they could hardwire that into what they normally do. Or sometimes doing the wrong thing actually helps you understand what the right thing might be. And so that cycle of learning is really what our secret sauce is in helping organizations figure out how to get better.
Talk to me a little bit about what it means to the organizations that you've worked with over the years, and now Mason Health, to have this recognition level, to be part of the Baldrige Excellence Program there, as folks are maybe searching for companies or looking and doing their own homework. When something like this pops up on their About Us page, what does that mean?
Well, I would say that it's similar to doing like a JD Power kind of recognition, or something that might be similar to a Good Housekeeping, seal of approval. It's essentially an external organization looking at them in an objective way and then validating what they're doing, and then recognizing them for their level of performance. So it's really one thing to also note, I think that's important, is that organizations are really competing against themselves. They're not competing against other organizations necessarily. What they're trying to do is they're trying to achieve their highest level of performance. We do have comparisons as part of the process. So as an organization goes along, we do ask them to look at organizations that are providing similar services and say, based on what we want to accomplish, how do we perform relative to those other people? And we can get a pretty good feel as to how the organization's effectiveness compares to those that might also be high performing, and to kind of validate the process.
The website is performanceexcellencenw.org. If you or your company is looking to go through this process, it is a deep dive into all the great things that you are working on and can work on to be just the most effective and forward thinking and productive organization in your community. Theron Post on the call with me here has been working long years with Mason Health to get them to this Ranier level of excellence. They're going to be accepting this award in October, and it's really exciting for the hospital, especially, again, as I mentioned with the team, right around their 55th birthday for Mason Health. So, Theron, it was great talking with you, and really interesting to learn about what you and your organization does to help other organizations.
Thanks for having me today, Jeff, and congratulations to Mason Health. All your hard work is paying off.